When is the best time for a young woman, adolescent, teenager to come in to see a gynecologist? That depends on several things. Many pediatricians provide adolescent and teenage care for young women into their 20s. And if a teenager is having pelvic exams, getting birth control from her pediatrician, then there's really no reason to transition to a gynecologist until the pediatrician no longer feels comfortable taking care of her, or family practitioner, primary care provider. For most women, they are going to feel most comfortable transitioning to a gynecologist before they really need to see a gynecologist, before there's any problems. And the first visit to a gynecologist doesn't necessarily even need to include a pelvic exam. There's often just things we can talk about, questions to answer, make sure that she's very aware of anatomy, make sure she knows that a gynecologist is a great resource for her. If there are times when she doesn't feel comfortable talking to a mother, family friend, then the gynecologist is the person she should be going to ask those questions rather than her other teenage friends. And it's important for her to know that anything we talk about is confidential. Of course, I want young women to be talking to their mothers and families about questions and concerns they have, but it's good to know that there's another resource for them if they need it. So as a 17-year-old, as a teenager with your first GYN exam, what you can expect is really to be able to talk to your doctor and decide what you need at that visit. Your very first visit may or may not even include a pelvic exam. It may be talking about questions you have, concerns. If there aren't any problems, if we're there to talk about fairly normal things and do something like a general physical, then the pelvic part of the exam could be incredibly minimal. It's not necessarily going to entail a full GYN exam. And the conversation that you have is completely confidential, so anything that you want to bring up with your gynecologist, don't hesitate to do. So a teenager's knowledge about her anatomy, sexuality, medical care related to gynecology can vary. There can be young women who are very mature for their age and understand a lot about their bodies and what they need and should be doing. And there are women who really don't understand much about that. And exams and the things we talk about can be catered towards where their knowledge base is. There's no such thing as a silly or embarrassing question. I approach all teens the first time I'm seeing them with the same kind of information, regardless of whether I think they have that information or not, because there's a lot of misinformation out there too. You hear about what a gynecologic exam is like from your best friend who went last week, and that may not be what we're going to do at all. Even women in their 20s and 30s don't always understand what we're doing and why and what the different parts of a gynecologic exam are. A gynecologic or pelvic exam essentially has three different parts. The first part is looking externally at the external genitalia, the labia, the vulva, and making sure there's no problems, skin changes, anatomy's normal. The second part is the part that usually everybody is worried about, gets uptight about, and that's the speculum exam, using the equipment to actually go inside the vagina, look at the cervix. It literally takes about a minute. It's very fast. It's not nearly as uncomfortable as sometimes people make it out to be. And it sometimes doesn't even need to be done. It's the way we actually obtain a pap smear, which is the screen for cervical cancer, but not all women need that test every time. And it's also a way, again, to look at the anatomy of the cervix. It's a way to obtain samples for sexually transmitted disease screening, see if there's any problems with infections. But it's a very quick part of the exam. And then the final part is actually a feeling exam, feeling the anatomy internally, the uterus and ovaries and tubes. It's important for young women to know that when they are even under the age of 18, GYN care is completely confidential, including treatment for concerns for pregnancies, birth control, and sexually transmitted infections.